Welcome back, viewers, to Faith and Discipline podcast. Our guest today is Dr. Behram Khan. He is consultant rheumatologist. Welcome, Dr. Khan, to Faith and Discipline podcast.
Thank you very much. Thank you for inviting me here today.
Right. Okay. So my first question is, what is uric acid?
Uric acid is basically an end product of purine, which is a chemical compound, and this is made of carbon and nitrogen atom. And basically, our body has purine anyway, naturally, and then we take some things from outside, external, which contains purine. Okay. So purines is broken down by metabolism, and the end product is usually uric acid.
So what is the role of uric acid?
So uric acid has been shown to work as an antioxidant in our body. By this I mean that if there is any chemical changes that are occurring in our body, to make it simple for your viewers, there are chemical radicals that are produced, so and they can affect your cells. So basically they prevent damage by these chemical radicals. It has also been shown to work as a stimulant for your immune system.
So your point is we need uric acid, but if it is not in the right amount, it will cause problems.
Definitely. So uric acid ranges. So it ranges from 250 to 450 micromole per liter. So that's the normal range of it. So people can have high uric acid as well, but it necessarily does not mean that they have got underlying problems. So it does not necessarily mean that we need to treat a patient who have got high uric acid without any symptoms.
So what are the causes of hyperuricemia?
As I mentioned just ago, the purine metabolism leads to the end product, and that is uric acid. So things like we take from outside, the purine, like meat, fish, crabs, these all contain, they are rich in purine content. So breakdown of it will lead to increased uric acid level. Then sometimes the uric acid is basically excreted via the kidney in our urine. So if there's any problem with our kidney and urine system, the uric acid will start to accumulate on our body. So it could be either due to overproduction, taking things from the outside like meat, like crab, fish, taking a lot of alcohol, beer, can cause a lot of purine, and that will lead to increased uric acid. And if you've got kidney problems, which means the uric acid will not be excreted. If you've got kidney stones, it can lead to decreased uric acid excretion. So that will lead to raised uric acid levels.
Okay, so you mentioned meat and fish. What about eggs? Do they also contribute towards?
No, not much. So dairy products usually, especially the recommendation is if anyone who's got high uric acid, so they should be taking more low-fat dairy products like low-fat milk, low-fat yogurts, things like that.
So is raised uric acid harmful?
So as I just mentioned, so uric acid raise in itself does not necessarily mean it's harmful, because uric acid, as I mentioned, is normally required for our immune system. So unless and until uric acid causes problems that we'll talk in a minute, affect your joints, if you affect your kidneys, if they make stones, then that's the time when they can be harmful and they needs to be treated.
So are you trying to say it varies from person to person? For some people it doesn't cause any issues, but for other people it can cause issues?
Yes, it can. That's the correct thing. Yes, it can cause issue for some people, and there's a lot of risk factor dependent on it. And then if it causes symptoms, like if it affect your joints, that we'll talk in a minute, or your heart, or if it affect your kidneys, then that's the time that it should be treated.
Okay. So how can we treat uric acid?
So usually uric acid on its own doesn't need treatment, as I said, but if it is high, then the first thing is that we have to modify our diet. So take less purine products like meat, crab, fish, decrease alcohol intake, beer intake. All of these can lead to increased uric acid production. The other thing is that regular exercises, drinking plenty of water, at least 1 to 2 liters a day, will help to flush out the uric acid from the system.
So if we are taking too much water intake, it will excrete a lot of urine. And then what about electrolytes? Will the person become electrolyte deficient?
Not necessarily. So body is continuously replacing the electrolytes. So the electrolyte level will be same. And normally, ideally, we should be anyway taking at least 1 liter of water daily in our day-to-day use. Then there are other things like taking a lot of vegetables. They are quite helpful. They decreases your uric acid level, and particularly citrus fruit, which contain vitamin C. It has been shown to reduce your uric acid level. So we usually encourage high fiber diets.
High fiber. Okay. Yeah. What about tea and coffee? Does it have any effect on uric acid?
No, it does not show any effect on increasing uric acid level, okay, as far as I am aware.
Okay. So is there any link between hyperuricemia and metabolic syndrome?
So metabolic syndrome is basically a medical term. It compromises diabetes mellitus, hypertension, and obesity. So this is encompassed into metabolic syndrome. So anyone who has metabolic syndrome and has raised uric acid has been shown that they can have heart problems. They are at high risk of cardiovascular heart problem, particularly heart attacks. They can have strokes. The cholesterol can get deposited in their blood vessels. So it is definitely related with the metabolic syndrome, and that's why we will treat it if someone has got these underlying conditions.
For our viewers, we have already discussed metabolic syndrome in one of our episodes when we talked about fatty liver disease. So we talked about in detail that one as well. Okay, so can we manage hyperuricemia without the use of medication?
So hyperuricemia on its own, again, it does not necessarily need any treatment unless it is affecting your joints, if it is causing stones, as I mentioned. So the way forward, just to treat hyperuricemia on its own without it causing any problem, will be just conservative by lifestyle modification, by ensuring that you take a well-balanced diet, a lot of fiber diet in it, low dairy products in it, regular exercises, drinking plenty of water. So that will be the usually management. Otherwise, on its own, it does not need any tablet form of treatment, no medications.
No medication. Okay. So a disease is quite well known. It's called gout. What is gout?
So basically what happens is that the uric acid, they form crystals and they deposit in the joint. When they deposit in the joint, then the patient will present with pain. They will notice redness. It will be warm to touch. They will have stiffness. They won't be able to move their joint. So this is known as gout.
So what are particular symptoms related to gout? Because they can be symptoms of any other issues as well in the body. So what are the particular symptoms that can only be associated with gout?
So usually it's patient will notice sudden onset of acute attack of swollen joint, and usually it is early morning, like from 12 a.m. to 12 a.m. to 8 a.m. Usually patient might be in hospital. They will be not drinking enough. They will be starving, dehydration. It can precipitate an attack. Like any patient is ill, it can precipitate an attack. And what happens is that the patient will present with pain, swelling, redness, and they will struggle to move their joint. It will be quite painful. And usually, most commonly joint that is involved is usually your big toe, very classical, and it's known as podagra in medical terms.
Okay. There is another term called arthritis. So rheumatoid arthritis, or it can be, pain, aches and pains in the body, especially in the joints. So what is the difference between the arthritis and gout?
So arthritis is basically a general term which means inflammation of the joint. So it could be due to many various reasons. To simply classify it, I will divide it into simple inflammatory arthritis and osteoarthritis. So osteoarthritis is usually a condition which affects the cartilage, where you lose your cartilage, and it's more common in elderly population. The other type is inflammatory. There are many subtypes in it. One of those subtype is gout.
Okay. So how do we diagnose gout?
So ideally, it is usually diagnosed with taking a fluid from the joint, the involved joint, which is called synovial fluid, and we send it to the lab, which is examined under the microscope, and they have got characteristic crystals, urate crystals.
Okay. Can we diagnose through blood test?
Yes, the uric acid will be raised, but uric acid on its own raised does not necessarily mean gout. So ideally, we should be taking some fluid out. Now, if it is a small joint, we can't take out any fluid. Then there are non-invasive ways. So the most commonly used is ultrasound scan. Okay. An ultrasound scan usually can show us a very characteristic appearance, which is called double counter sign. Okay. More latestly, now we have got CT scan, a particular CT scan that's called DECT scan, which can pick up this uric acid crystals within the joint.
Oh, okay. So, the procedure to take the fluid out from the joint, is it painful?
So usually it's no more pain than any injection anyone has in their life. So it will be a bit painful, but not much. Not as severe, as painful as the attack itself.
Okay. So do you use local anesthesia for that?
So local, we do not. We usually make sure that we thoroughly clean it, use aseptic non-touch technique, and if required, we can use local sprays. We can apply local anesthesia if needed.
Okay. And which joints are affected by gout?
So the most common joint is the big toe. That's the classical joint that's affected. Apart from this, and almost every joint can be affected. Your knees, your wrist, your elbow, shoulders, and even there are cases of gout in the spine.
All right. So how do we differentiate the pain in the joints when patient is suffering from gout and compare with the patient suffering from arthritis? So what is the difference between?
So as I said, if it is a gout attack, it will be the pain will come all of a sudden. The joint will be swollen, red hot. Patient won't be able to touch it, and they will be in severe pain. While the other type of arthritis, like osteoarthritis, it is usually a dull kind of pain. They will have morning stiffness will be usually less than 30 minutes, and then the patient will themselves they know that this is an attack of gout.
Okay. So how do we treat gout?
So usually it's treated in two phases. The first is treating the acute attack. So during the acute attack, because there's a lot of inflammation going on around the joint, so we usually prescribe anti-inflammatories to settle the inflammation. So most commonly colchicine, naproxen, and medication like ibuprofen can be used. Sometimes patient can't have these anti-inflammatories, either they have side effect or they have got kidney problems, then we can give them steroid tablets over a few weeks. Sometimes if it is a single joint like a knee joint, so what we do is we can just inject steroid into that joint.
Okay. So if you are prescribing just anti-inflammatories, so they will just help with the pain and the swelling, things like that. But how would the uric acid crystal will dissolve? Do they dissolve over time itself?
So that's when we come to the second stage. The first stage was attacking the acute attack. Now is how to treat gout. So once the acute attack is settled, we commence them on uric acid lowering tablets. The most common is allopurinol. And we gradually start them, and we gradually increase them every 4 weekly. So usually the target, we are trying to achieve a target, and as per our British Society of Rheumatology, the target is 300 micromole per liter. Okay. And even when we start the allopurinol, we just give them prophylactically, we give them some anti-inflammatories, because once we start allopurinol, there is also a risk of flare of the gout.
So for how long it is safe to take the medication?
You mean anti-inflammatories? So it depends. As long as they are having flare, they can take it a few weeks to months as well. Sometimes they need it for months as well. So as long as they are in symptoms, they are having the flare, they can take it. Unless it is affecting their kidneys, then we have to think of steroids or a steroid injection.
Okay. So what about a gout treatment medication? For how long the patient need to take? Is it lifelong?
So usually as per our society recommendation, if a patient had first attack, then usually we do offer the treatment to start the gout medications. But if patient has had at least 2 attacks in a year, then we definitely start them on treatment, and it is usually for lifelong. If patient has been asymptomatic or no flares for many years and his uric acid is quite under good control, then we may consider weaning it down gradually and then stopping it.
Okay. Are there any side effects of those medications?
So usually the most commonly medication that we use is allopurinol. It can cause a side effect like skin allergies, allergic reactions. And then once we are escalating the dose, we have to monitor their liver and kidney profile to make sure it's not affecting their liver kidney.
Okay. So we talked about if there is an attack, how do we deal with that? What about prevention? Any preventative measure we can take?
Yes, so in terms of prevention, so the first thing that we recommend is that any patient who is known to suffer with gout and is on treatment, they should be taking their medication regularly, not skipping it. They should be adopting conservative measures like avoiding alcohol, beer, avoiding purine diets like meat, fish, crab that we mentioned, doing regular exercises. So that will hopefully help prevent any flares.
Okay. So are you saying they need to stop it altogether, or they need to reduce the quantity of taking of meat and fish?
So ideally they should minimize their use of purine products.
What are your suggestions on lifestyle? Are there any modification anyone can do to prevent gout, and any patients who are suffering from it, they can make their life, quality of life better?
Yes, definitely. So gout on its own does not just affect the joint. It can, as I mentioned, can affect your kidneys. It can cause stone. It can cause heart problem. So it is necessary to modify your lifestyle. So if you are overweight, if you are obese, so you have to lose weight. You have to make sure that your blood pressure is under good control. Diabetes are under good control. You are taking your regular medications. There are certain medications for hypertension which can increase the uric acid as well. So unless they are definitely needed, and if they are just given for blood pressure, they need to be changed. And adopting a healthy lifestyle, taking a lot of fluid, water, and avoiding the fringy drinks like Coke, and this can also lead to increased uric acid levels.
Okay. I've got a general question right at the end. Some patients, they complain about migrating pain. They say sometimes I got feel pain in my right thigh, sometimes it's moving to my shoulder, and keep moving in the body. So migrating pain is a sign of fibromyalgia, or is it due to arthritis or hyperuricemia?
So normally the migratory pain is usually in medical terms called as palindromic arthralgia. So what happens is that patient will present that they had a pain, for instance, in their right elbow, and that pain settled. Now they have developed a new pain in their left shoulder and some swelling, and then that is settled. It has moved to another joint. So this is usually common in rheumatoid arthritis, which is another type of arthritis. So that's usually more common. They not necessarily in fibromyalgia. In fibromyalgia, they will have generalized pains, fatigue, tiredness.
Okay. Thank you very much, Dr. Khan, for joining me today. I believe our viewers will find this information very useful.
Thank you very much for inviting me here.
Thank you. Many thanks, viewers, for watching this episode. If you found this useful, you can share with your family and friends. And if you haven't already, make sure to subscribe to this channel. Many thanks.